We will discuss with the patient the non-operative choices that they have. Injection therapy of anti-inflammatories such as cortisone, lubricating injections. Bracing can be extremely helpful, though bracing, even when it is successful, is usually not well tolerated as a long-term solution.
There are a variety of options. These options include oral anti-inflammatory medication, topical anti-inflammatory medication, injections of several varieties. In addition, we offer platelet-rich plasma injection, which is a process by which we draw the patient's blood. We select the platelet portion of the blood and concentrate the growth factors, and there is evidence that that can improve patients' arthritic pain. When it gets beyond non-operative measures, though, many patients then are interested in pursuing a more permanent solution, which would be joint replacement surgery.